Hi everyone, welcome back to Beyond Your Knowledge. So we're going to be studying the anti-arrhythmics. And then we already saw in the first video. So now we're going to see some more. So anti-arrhythmic sodium channel blockers, we saw the class 1A. And so with that in mind, we can move on. And I would like to share with you Proverbs 29:20, and says that the fear of man lies near, but whoever trusts in the Lord is safe. Okay, now the other one that we're going to see is class 1B. Okay, in the class 1B, so let's just start with the drugs, that's the name of the drugs. So we have 3. Okay, actually 2, sorry. So actually 2, yeah. What is the number letter? The letter B in the alphabet is the second letter of the alphabet. So we have also 2 drugs just to learn. One is called lidocaine, and then the other is called mexiletine. Okay, so mexiletine. Now, what is the mechanism of action of lidocaine and mexiletine class 1B antiarrhythmics? So they are going to decrease your action potential duration, so which is different to class 1A, because class 1A increase your action potential, but this one is going to decrease your action potential and duration. It is very important to keep that in mind. Now, this one, the preferentially affect ischemic or depolarized Purkinje and ventricular tissue. Okay, so what is the preference of this one? So the preference, basically, it is preferentially affects the ischemic, okay, or depolarized Purkinje cells. And ventricular tissue. Yeah, so this classification, it is pretty common, but I'm using as a guide the first aid 2017, yeah, for this classification. Now let's see. Another thing that we should keep in mind here is phenytoin is another drug. So you remember I just mentioned lidocaine and mexiletine, but yeah, so the phenytoin can also be in class 1B, okay, but it is not as common as the others that we mentioned, like lidocaine and mexiletine. Now, I would like to show you brief as here how the action potential looks like. Okay, so you remember that decrease your action potential duration, yeah. Okay. So which is here, sorry, over here. So let's say the clinical use, I'm going to write it down here. Yeah. So we use it basically for acute ventricular arrhythmias. Also we use it for, especially when post myocardial infarction, okay, or after myocardial infarction. Okay, and for induced arrhythmias. Induced arrhythmias. Keep it there. Where there are some side effects we're going to mention, and the side effects is there's side effects is, for example, in the central nervous system, could be central nervous system, so stimulation and depression, or cardiovascular depression. So basically depressed. Why do you think that is going to occur, this cardiovascular depression or the depression of the central nervous system stimulation? Well, it is easy. Do you remember that decrease your anterior refractory period, your action potential, yep. So you left the bar less, so you work less signals we send it. Okay, and just a mnemonic here, for example, class 1B, be the best for post myocardial infarction. Okay, now we can go and see the class 1C. So the class 1C, we are going to see two. One is called flecainide, and then the other is called propafenone. What is the mechanism of action? So the mechanism of action, it is that this one significantly is going to prolong your ERP, okay, in your AV node. Okay, so effectively, significantly prolong your effective refractory period, which is ERP, in the AV node. And this is class 1C with flecainide and propafenone. Also, the mechanism of action of this one, it is the prolonged ERP in the AV node and accessory bypass tracts. Okay, now no effect on ERP in Purkinje and ventricular tissue, so which is good too. So no effect. What is no effect in where? And in refractory period in the Purkinje cells. Okay, and ventricular tissue. Okay, versus the other one, the class 1C, the class 1B, so they affect professionally the Purkinje cells. Okay, so that's what we saw here. Okay, class 1B like more Purkinje cells, but class 1C doesn't affect the Purkinje cells. Now this one, class 1C, has a minimal effect in where? In the duration of the action potential duration. Okay, when do we use it? The clinical use. So we use it for patient that has the supraventricular tachycardia, including atrial fibrillation. This is class 1C. Okay, also So as a last resort, in refractory action potential period. There we go. Now it is VT, so it doesn't make sense because I just mentioned that one here. VT, yeah. Okay. Do you think that it's going to have side effects? Yes. So let's just mention some side effects. So probably in this area here, so we can see some side effects. Just do for arrhythmic. So también that can cause arrhythmia. When post myocardial infarction. Also, which is contraindicated. Yeah, and also contraindicating ischemic heart disease because it can cause then myocardial infarction. Okay. Heart disease. Yeah, so I think that basically is that with those class 1C. Well, I hope that you enjoy, and remember, watch the number one, and yeah, thank you so much for watching, and bless you.